older adult. Older adults account for the largest population of health users. Hospitalization and medication-related adverse effects, falls, dementia, and delirium. Not only those diseases themselves, but how these diseases present differently in older adults. The greatest mistake clinicians make is assuming symptoms are simply due to aging when they actually represent an acute medical problem. Aging is not a disease, it is a normal aging. It is aging process. However, aging changes cardiovascular, increase artery stiffness, increased artery stiffness, reduce cardiovascular reserve, increase blood pressure. Also, pulmonary changes happens in aging. Decrease lung capacity, reduce viral capacity happens in older adult. Renal changes also happen. Reduced kidney filtration and increased medication sensitivity happen in older adults. Neurological changes happen. Slower processing speed and mild memory retardation and delay happens. However, what is not normal aging? Delirium is not a normal aging. New confusion is not normal aging. Hallucination and significant memory loss is not aging. Major function decline is not normal aging. Falls with injury is not new aging. Newer confusion, falls, or acute weakness is not just getting older. So, comprehensive geriatric assessment. Comprehensive geriatric assessment is the foundation of medical assessment. When you want to do the comprehensive geriatric assessment, you have to do 5 domains. The 5 domains of the comprehensive geriatric assessment include medical review. Medical review include chronic diseases, medication history, sensory deficit that the patient may have. You want to assess and evaluate functional decline. ADLs. You want to assess the ADLs. You want to evaluate the ADLs. Cognition. You want to screen for cognition abnormality. You want to screen dementia. delirium and depression. Screen dementia, delirium, and depression. Psychological, you want to assess mood, anxiety, and coping skills. Social assessment include care support, living situation, financial burden. Functional assessment. Functional assessment include activity of a daily living, basic self-care tasks. Activity of daily living include the bath. Is this patient able to, or is this person able to take a bath by themselves, dress themselves, tolerate themselves, transfer themselves, or how they transfer? Continence or incontinence. Feeding, can they feed themselves? You want to assess those. You want to assess what they lost. Patient can still eat and dress but cannot manage medication. This indicate loss of independent life, independent activity, daily living. Instrumental activity of a daily living include higher level of independence function that include financial independence, shopping, transportation, cooking, medication management, housekeeping. You want to assess disease progression pattern. You want to assess delirium. Delirium is acute disturbance of attention, awareness, cognition. So you want to assess attention, awareness, and cognition. It happens within hour to days. Pathological, usually trigger when a baseline vulnerability meets a psychological stress. Vulnerability such as dementia, fragile sensory impairment, stress, infection, medication, surgery, metabolic abnormality, classification. A 82 years old who has normal yesterday, now they are pulling their IVs, does not recognize their family, cannot focus, becomes agitated at night. This is delirium until otherwise. So how to assess delirium? You want to assess the confusion. Is this acute onset or fluctuates? Inattention, disorganized thinking, level of consciousness. Common causes of a delirium include drugs, electrolytes, lack of or withdrawal of medication or drugs, infection, reduces sensation output, intracranial infantis, urine retention, metabolic disturbance, high-risk medications. High-risk delirium medications include anticholinergics, benzodiazepine, opioids. Dementia is defined as progressive decline in memory, in executive function, language, daily function. Alzheimer's is the most common dementia. Approximately 60 to 80% of the cases are dementia. Approximately 60 to 80% of a dementia are related to Alzheimer's. Early findings: repeating question, losing objects, forget conversation, progression stage, short-term memory loss, language difficulty, behavior changes, loss of daily activity of daily living. Alzheimer's brain regions include hippocampus. Therefore, memory impairment is the first symptoms. Vascular dementia is the second most common dementia. Risk factors include hypertension, diabetic, stroke, and smoke for vascular dementia. Lewy body dementia. Dementia has visual hallucination, parkinsomnia, sleep behavior disorders, patients act out their dream. Patients are extremely sensitive to antipsychotic medication like the Haldol. Frontal temporal dementia happens to younger than Alzheimer's, often 50 years to 60 years old. First symptoms is not memory, but personality changes, disinhibition, poor judgment, previously polite executive becomes socially inappropriate. Depression in older adult. Pseudodementia. It's called pseudodementia. And symptoms include poor concentration, memory complaints, psychomotor slower. Important distinguish depression patient complain about the memory problem, dementia. Falls. Falls is usually multifactorial And common contributors are the medications such as benzodiazepine, opioids, antihypertension, visual impairment, neuropathy, orthostatic hypotension, cognitive impairment. So always assess the circumstance of the fall, assess the orthostatic vital signs, medications, vision changes, gait changes, neurological exam. Fall is maybe the first sign of UTI, stroke, arrhythmia, or delirium. Friendly fractal criteria is the weight loss, weakness, exhaustion, slow gait, low activity. Frail predicts hospitalization, disability, mortality better than age alone. Fall is dementia, hospitalization, drug interaction, non-compliant with medication. Beers criteria. Beers criteria identify medications potentially inappropriate in older adults. These include dihydroamine, amitriptyline, diazepam, mibritine. If a confused older adult is taking dihydroamine, think medication toxicity. Urinary incontinency, stress weak with cough. What causing that? Is that the stress weak with cough? Urgency, sudden urgency, is the most common. Overflow, functional decline. What are the red flags? Red flags are repeated injury, malnutrition, caregiver inconsistency, poor hygiene. Those are neglect. So you want to assess psychosis, mania, anxiety, dementia. You want to also assess the vitamin B12 deficiency, because vitamin B12 deficiency can mimic dementia, depression, and psychosis can cause that. Hypothyroidism can mimic depression and confusion. UTI can present as confusion, agitation, and behavior changes. So delirium, when you see acute onset, delirium equal to acute onset, Dementia is a gradual onset. Inattention is a hallmark of a delirium. Infection commonly causes delirium. Medication commonly causes delirium. Delirium is reversible. So the delirium can be treated. Dementia is not reversible. Also, you can treat the progression, you can slow down the progression of dementia, but it's not treatable or it's not reversible usually. Alzheimer is the most common dementia. Vascular dementia is stepwise decline. Lewy body dementia has a hallucination. Frontal temporal dementia has personality changes. Follies have a multifactors. Polypharmacy increase follies. Orthostatic blood pressure. Orthostatic hypotension causes follies. Fragile predict mortality. Benzodiazepine increase fall risk. Anticholinergic increases confusion. Beer criteria identify high-risk medications. Depression can mimic dementia. UTI may present only as confusion. Acute confusion is a delirium until prevent otherwise. Hallucination and parkinsomnia is the symptoms of Lewy body dementia. Memory loss is the first symptoms of Alzheimer. Functional decline is never normal aging. Older adult who develops acute confusion, agitation, and hallucination and follies or sudden functional decline has medical problems until prevent otherwise. Most common are infection, medication, effects, metabolic abnormality, dehydration, delirium. Those are not primary psychiatric illness. Thank you for joining me today.